When you are looking at the bones of the wrist and hand, you can tell if you're looking at an anterior or posterior view by looking at some of the carpal or wrist bones. So these are our carpal bones or wrist bones, and the pisiform bone kind of projects anteriorly, and then there's kind of a little hook shape on the hamate bone that also projects in the anterior direction. Now the hand can be a little confusing because you would think an anterior front of the hand, which you might think would be this way, but remember, when we're in anatomical position, we're standing with our palms facing out. So when we're talking about anterior, we're talking about palmar, this side of the hand. So if we're looking at this hand, then we would know if this is the anterior view because of these wrists, the hooked hamate carpal bone. We would know that this is the right hand because we have a shorter digit here, which is going to be our thumb or pollex. So we have the carpal bones, we have the metacarpals, and then the phalanges. And when we're looking at the phalanges, we have a proximal, a middle, and a distal phalanx. On the thumb, we only have a proximal and a distal phalanx. And the metacarpals and phalanges are numbered from 1 to 5, starting at the thumb. So we have 1, 2, 3, 4, 5. So if, say, I was having you look at this bone and name this bone, you would say this is the proximal phalanx of digit 1, 2, 3. So proximal phalanx of digit 3, middle phalanx of digit 3, distal phalanx of digit 3. You are not required to learn the individual bones of the wrist, but if you are interested and wanted to learn them, bless you. We have this is looking at the anterior view. We know that because of the hooked projection here of our right wrist. Hold on. We have the trapezium, the trapezoid, the capitate, the hamate, the pisiform, which is fused in many of these models with the triquetrum, the lunate, and the scaphoid. The scaphoid is the most commonly fractured carpal bone, and then the lunate is the most commonly dislocated. So that's scaphoid, most commonly fractured. Lunate, most commonly dislocated. Trapezium, trapezoid, capitate, hamate, triquetrum, pisiform.